the rain can rain can come, water can go into the hospital in compound. Retired General Brahim Assisi talk this for Seka, where Chief Minister David Senge go waka na the National Disaster Management Office, the headquarters. For more on this, Adeyemi Jackson gets more in Ghana report.
Thursday, August 1 this year, the Chief Minister, Dr. David Senge, been do one unannounced visit to different ministry, departments and agency them. And this waka with the Chief Minister do, now for know the different challenges where MDAs and the face, and self know if workman they go work on time. During this waka, the Chief Minister been go to different office them, check their attendance, and self-engage workman them for know waiting at them challenges within the face and how for solve them. The Chief Minister, Dr. David Senge, been first visit the National Disaster Management Office, and the Director General for this agency, Lieutenant General retired Brahim Assisi, been start for brief the Chief Minister, but waiting at them work.
Issues around waste management, building in waterways, blocking waterways around Freetown, the activities of cutting trees or doing construction on hilltops. When it rains heavily, all of the debris now flows into the water passages, into the gutters, and areas that were not, in fact, initially had no problems with flooding becomes a challenge. What we do every year is to identify those areas that are prone to risk or to disasters, and then we develop the volunteer system. We have volunteers in all of these areas.
How do you recruit volunteers?
We bring them, we identify them from their communities in the first place. We bring them into the agency. We give them some training.
How many staff does the agency have?
This agency currently has 77 staff.
And you're nationwide?
We are nationwide, mostly with the regions.
Yeah.
We're in Freetown, the headquarters.
After we take in time for explain about the thing that way the agency don't do for address disaster-related issue then at the country, the Director General for NDMA, Lieutenant General retired Brahim Assisi, not be waste time for draw the attention of the Chief Minister, but the issue na Connaught Hospital.
We received that letter from the administration of Connaught Hospital, and then we went there, we did the assessment. After the assessment, we now wrote a report of that assessment, which was sent to the Office of National Security, the National Security Coordinator, and you were copied as well. And all the relevant MDAs that are supposed to take the appropriate actions there were copied as well. But actually, it's a structural problem with the Connaught Hospital because of all of the water that is coming down from Shakasivin Street, some of these small streets that are around Waterloo Street, and it all runs down into Connaught. And the drainage is not sufficient to hold all of that water, so it flows into Connaught Hospital. That is the challenge with Connaught Hospital. So that one is an issue for SLRA. In fact, in one of the meetings we held last week at the Office of National Security, which the Environment Minister chaired, that task was given to SLRA. The response has not been too perfect. So most times I have to go either through your office or I go through the Office of National Security, ONS.
Where it respond for sake the issue na Connaught Hospital, the Chief Minister be start for confirm the letter where he received and ask the Director General for NDMA for work with the Ministry of Health and other body them for address them. From the National Disaster Management Agency, the office, Dr. David Senge, been going to new building. Also visit different ministry like the Ministry of Agriculture and Food Security, Ministry of Health, Ministry of Fisheries and Marine Resources, Local Government Ministry, Ministry of Mines, and other one them. Dr. David Senge, we also go to the Ministry of Lands. Also, the minister will give updates, but what they don't do for transform the ministry?
Well, we have this World Bank project. So what I've done is to make sure that the projects, we leverage on what the project can make sure so we scatter the Wi-Fi, internet connectivity across.
I think it's a good thing that because in terms of connectivity in terms of the work that happens, yeah.
But I think it's happening. It's going fine. Digital platform is working well. Now people are now paying online.
Awesome.
And then the building permit itself is now going also online. Pluralization of ownership of land is also online. And then we are now trying, next week.
Payments, are the payments integrated online or?
Everything is online. You can use your telephone, Airtel money, Africell money, Smart Corpo, and then you pay directly into the consolidated.
That's fantastic.
Yeah, that's
really good.
After several discussions with staff then at the Ministry of Lands, the Chief Minister, Dr. David Senge, will later visit the Electricity Distribution Supply Authority at the office. And the first thing where the Chief Minister be meet, now plenty people them will meet the line. They wait to buy top up for the meter then.
But the line's slow.
The line very slow from morning still can. I want to go market and able to go market. I just want to buy football.
You know about so chief. Now this TID rollover now, I don't make a bit more. Because now, what man understand, it's just an upgrade. Nothing is changing to the process.
But have you told them?
We are working through them, yes, sir.
No, but yeah, that's why you have to come.
So,
if you go, you don't talk to now. Okay, look. But you have to talk to them. Because the people are standing in line.
What we are doing, chief, as you approach the gate.
But you should talk to the ones
around
worse there, because they own the fire.
That's fair.
Because this is the way they are in here.
We engage them, yes. That's fair. We'll go around and do better. That's fair. But what we are doing
sorry,
now, we apologize.
But I will go add more people there. Four double now. Okay. Who counts 4 other people there? Okay. So you have to clear the car. Good call, Bennett double now.
All right.
After all this, the chief minister been taking time for explain to journalists the way be present, but the reason why he do this waka.
But today, again, drop by several departments and agencies, then Ministry and building, Ministry of Energy, NDMA, for just engage and see what's the challenge they would get, how they will resolve and challenge, then see how the work will happen, because public service delivery now one by the presidents in Big Five.
Dr. David say they go do similar visit to other MDAs them for know the challenges whether they face and serve out for address them challenges them for the Society for Radio Democracy. Adeyemi Jackson, the report.
The program Midday Show, they continue and they come to you from the Society for Radio Democracy 98.1 FM. We still they continue with the studio guests. We na Mariama Eli inside the program, and don't forget to yourself for the listen or watch me on Radio Democracy.
Better no more way than give me now. I don't eat, but yes, you don't eat because now same nutritional value in a rice they give you don't get them inside na cassava or na gari where you don't eat. But not just a staple. We sauce the way we can prepare basically can compose of all the different nutrients that they look for. So you go get your protein inside because you go get your fish inside, or sometimes you meat some man and chicken. You go get your leafy vegetables there. So we potato leaves, we cassava leaves, we green, all of them, and then they vegetables them what we they use. The only side where we can get concerned now how then they prepare them. Therefore be mindful, because when you overcook them, you they lost the micronutrients then where then they inside the vitamins and the micronutrients. So you get to be careful, overcook them, otherwise you they destroy them. But then we sauce them alone, able for accommodate all the nutrients that you need for make you eat healthy. Now just that you make sure say, well, I don't know what you could call sweet, because yes, sauce. But when you say sweet, what goes sweet to you might not be healthy. That's another thing, because if, for example, you don't put too much of salt in it, for you it might be sweet. If me eat them, I go tell you say, this is too salty. It's not healthy. So we not for they look for sweet. Before they look for healthy. Waiting healthy now for go for. So salt now one thing where you take in moderation. Very small. But now we they see say people they cook, go put salt, go put Maggi. We get all kind variety of Maggis right now we they take. Nanaris in they make globally. The World Health Assembly and scientists and governments around the world, now World Health Assembly, agree say there need for be a law we go able for protect, promote and support breastfeeding for make picking they able for survive around the globe. Now that being around World Breastfeeding Week celebration. Now,
for other initiative or other thing the way they can want to make change to, it can be one day, but for breastfeeding now week. Why?
Well, now so the global people then design them, now so then decide them, because I guess one day enough. Even the 1 week enough. This is something we do every day round the clock. Just that then focus on this particular week for make we able as much as we could for galvanize, for inform and for engage people them around breastfeeding. So amongst all the days them this week, now the week where they find out say we dey at we peak. So around the globe, nationwide, within Sierra Leone, not just Freetown, so all 16 districts, they celebrate this week. And if you go to any district, down to Falaba, down to Kailaun district, then they celebrate World Breastfeeding Week, and everybody is on air speaking about it at community level, saying something about it.
So people go to listen now, say World Breastfeeding Week. Some people will not get the technical know-how. Go to wonder what are the activity them we specific body or health authorities them go to do, especially on a week for give Bobby water.
Okay, so the World Breastfeeding Week, we can get series of activities them all we can line up. We start them on the 31st na Atlantic for able for lunch, and also with a press briefing for the press people them, because like I say, now the week this way we can, you know, what they can say, with the hype with the hype the breastfeeding. The breastfeeding now for give picking Bobby water, make a candle so me Bobby in the sock. So motor man born motor man, he supposed for sock in mama in your Bobby human milk. So this not a God-given designed food that every creature way I make, I dey give and waiting for make in lineage continue. Yeah? So because if the mommy give in Bobby, which is the perfect meal for the child, you dey find out say the pikin they survive. And I make when we start, you say waiting our world, it's all about child survival. Waiting go make this pikin able for live. Now the bottom line. And if breast milk, they contribute immensely for ensure say na pikin they able for survive. And that is why we go say even a week is not enough. And then as something what they do every day, na part of routine work. You go to our health facilities, you go to our hospitals, you go to our communities. We have structures in place. It's not just this week, but we always did do them. So every mama supposed for do them, except in special circumstances. For example, if the mommy don't deliver and in a critical state where possibly the medical people then self-defect for the mommy in your life, at that point, those are the exceptional cases, and we know how to deal with them. Yeah, if there is a maternal death, we know the child for survive, and we know how to deal with that. Those are the only few things where we can consider. Otherwise, we can give as much information as we could so that mommy then kumbra them able for make informed decision.
Okay, continue for still to inside the program Midday Show. We come to you from the Society for Radio Democracy 98.1 FM 077981981. The number we will use for adding voice to this conversation, ask question or make comments to the discussion or the get in the studio. The program Midday Show will come to you from the Society for Radio Democracy 98.1 FM. We look at another issue. We go inside the statistician general na statistics salon Andrew Bob Johnny say round 7 of the multiple indicator cluster survey way statistics salon, around 7 of the multiple indicator cluster survey way statistics salon they do now go focus on teen them way they ambog woman and girl picking them. And Bob Johnny talk this way statistics salon go sign one agreement with UNICEF for support them on this survey. With this agreement, according to Bob Johnny, go help them for collect data we go target woman and girl picking them with mental health, maternal mortality challenge, and picking them where they suffer. For more on this, Alhaji Jallo go now report.
Some time back, inside the late 90s, UNICEF be introduced the multiple indicator cluster survey. Beside them, they use different tools and technique them for know about the status of woman and picking them. Now the country salon na one part the country we don't they do this survey independent one, but 6 term now as then they prepare for do the 7th round of this survey. Statistics salon when are the body where they deal with credible data for national development don't sign memorandum of understanding with UNICEF for sake of this survey.
But for all, this is a national theme.
Yes, this is a national theme, and in fact, not global theme. So globally, the theme they come, and so nationally, we set a target by 2030, when at 75%. So it tell we say we get a gap. What thing we go do for make able for closing that gap, for make we able for reach we target as a country now. We target with a shoot for 75%. And so now then gaps then we want for closing now. So the theme it fits very well. So how much partners do we have? How much will they work with? And how much more do we want on board? We need for open up and get more players in the field of nutrition. And also because the mothers will they deal with now, then they all over. Yeah, you get the one the way then at the formal sector, like me and you two where they work so now, and possibly I don't say when I get people the way they work where they of reproductive age, where they still born picking them, and you go to the banks, then they you go to parastatals, then they in the private sector, then they you get the informal sector also. We market to man the one the way they do them private business. So then a house as the case may be. So all of them different mothers, we get for consider them and see how we can close the gap and create breastfeeding as an equalizer. That in as much as this formal mama they get support, the begin them on the right footing. As them born a pikin day, within 1 hour, you for put the pikin to the breast. So we health personnel, then they make sure say then do early initiation, and so with man call them. So they put the pikin to the bobby, they begin suck within 1 hour. And after that one, they from na day, so tell the pikin 6 months. Now bobby watan no more, take in 6 months. When the picking 6 months, you they begin get other yam plus the bobby water sort of in 2 years or it can even pass 2 years. Now one day na the infant and young child feeding recommendation. Now where they we suppose for feed we picking them. We not say come brother and they feed them picking them, but you they feed them the way where you suppose for feed them as per the recommendation. So if I forget take home, now this now the take home so that we'll go able for feed we picking them the way we suppose for feed them.
All right, plenty thank you where you join me today inside the program. In name na Mayama Eli, Senior Nutritionist Directorate of Food and Nutrition at the Ministry of Health. And if they are for talk about World Breastfeeding Week, we don't start from the 1st of August and they continue to the 7th. As the theme for this week is say na closing the gap, breastfeeding support for all. And you don't discuss about that and the importance of nutrition and everybody in life what you're waiting for it and things like that. And with the activity the way they don't engage part, we go try to make sure say we get other personnel and from this directorate so that we can look at other issues them with the directorate mandates they look at. But for this edition, this has been the focus on World Breastfeeding Day, as it don't give you much more idea for looking to for keep it in our mind.